या इंडिविजुअल ग्रुप पे जगदीश को जो है ना व्हाट्सएप भी कर सकते हैं। ठीक है, सो टुडे बिफोर एग्जामिनेशन से पहले वेरी इंपॉर्टेंट थिंग टू शेयर विथ यू पीपल दैट history is always very important. The most of the cases of pulmonary or any other system are almost 80% of cases are diagnosed with good and relevant history. So एग्जामिनेशन अलॉन्ग विथ हिस्ट्री विल जो है ना आपके वो इम्प्रूव करेगा आपको 85 to 95% of sensitivity कुछ जो स्टडीज कहती हैं. So today we will only discuss about the examination, and in our next lecture we will discuss how to interpret our findings and few important cases which are very important during examination, फाइनल ईयर और ड्यूरिंग एनी एग्जाम जो है ना आपका बाद में जो है पार्ट टू कुछ भी हो उसमें जो है ना कॉमन केसेस होते हैं वो थर्ड ईयर से लेके ऑनवर्ड. So clinical examination of the respiratory system is carried out to assess the functional status of the respiratory tract and lungs. So before doing any examination, आप चाहे वो abdomen की करें या कोई भी other system, general examination is always important and the relevant जो है ना examination is always important. So general examination in pulmonary medicine includes the general appearance of the patient. So patient को देखना है whether he is in sitting position, he is in lying position, he is cachectic or thin built or जो है ना good built, normal built, height है. Most of our patients like tuberculosis and having malignancy, COPD, they are जो है ना very thin, lean and cachectic persons. ठीक है ना, using accessory muscles. While the other category like patient very obese patient of obstructive sleep apnea, you have heard about the OSA, they are morbidly obese patients. So appearance has a great significance on examination. And another is look at patient for the pallor. So as you all know that anemia is one of the well recognized cause of जो है ना shortness of breath. People think that patient has shortness of breath, it could be secondary to जो है ना underlying lung disease. But in actual, the lung is normal. Patient is short of breath only because of anemia. So always look for pallor. Another is cyanosis. So almost every disease in the respiratory system can present with the cyanosis. अब साइनोसिस के लिए ये है कि एटलीस्ट 5 ग्राम ऑफ द ब्लड जो है वो आपका डीऑक्सी हेमोग्लोबिन होना चाहिए. सो पेशेंट हु आर anemic having 7 to 8 hb, they do not have a cyanosis. ठीक है ना, while जो पेशेंट अबव 10 होते हैं उसमें सिग्निफिकेंटली नजर आती है. तो साइनोसिस जो है ना हमेशा देखें. और हमारे पेशेंट मोस्ट ऑफ पेशेंट जो ऑलमोस्ट एवरी डिजीज जो है ये ड्यूअली साइनोस होती हैं. और आपने जनरल मेडिसिन में पढ़ा होगा सब में कि जो है ना साइनोसिस जो है सेंट्रल होती है, पेरिफेरल होती है, उसके डिफरेंट काजेज होते हैं. और another important relevant finding include the clubbing. Actual clubbing है क्या, it is the excessive curvature of the nail bed. ठीक है ना. You have read about the many causes. The most common causes include respiratory जो है ना उसमें आपका bronchiectasis, empyema, lung abscess, malignancy and fibrosis. So these 5 are the universal causes of जो है ना clubbing. So from respiratory point of view, you should know about these 5 important causes. There are a lot of other causes, but up to final year level, we all expect you should tell about these 5 important causes, which include bronchiectasis on the top. ठीक है, other is आपका lung abscess, empyema, fibrosis, malignancy. So this is a pictorial diagram that shows the clubbed fingers and normal finger. Another is the venous pulses. So pulse जो है ना always do check about the pulses. Here we talking about venous pulses is about the JVP. देखो JVP is you have heard about read about it in cardiac examination. JVP is nothing but venous pulses of the heart. So venous pulses जो है ना whether इस patient को दूसरों मेडिसिन से जहाँ पे पड़ी होगी उसमें जो है ना देर आर मल्टीपल जो है ना hundreds of causes of lymph node enlargement. But in respiratory point of view, lymph node